Okay. Hi, everyone. Would like to welcome you to this webinar. I know we've only got about 7 people on board right now, but the others will probably join us along the way. We don't want to keep everyone waiting. A warm welcome to the Bid Learning webinar on how to engage with the Immunization Agenda 2030 Data Strategy and Use Working Group. A very special welcome to our guest speaker from CATI Collective, and this is the CEO, Kirsten Gagne, and I'm your host, Catherine Yola, the Big Learning Network Coordinator. So before we start with today's webinar, I would just like to walk everybody through the housekeeping rules. In the chat box, would appreciate it if you type in the name of the participant and the country where you're connecting from. And just for our record, we'd just like to know also if there are other people sharing the same connection as you. It would be good for you to add the number of people whom you've connected with on the same internet connectivity. We don't necessarily want to know their names, but then if there are 4 of you using one connection, we'd really appreciate if you put in the number. Then we're requesting all participants to be muted and also to have their videos disabled. Obviously, this is to allow the presenters to present without interruption, and also to enable those ones with poor bandwidth to be able to follow the discussions without any interruption. And just to let you know that there will be a question and answer session that will be held at the end of the presentation, which will be made by our guest speaker for today. And if we have any burning questions, please feel free to submit them in the chat box. They will be logged and answered during the question and answer session. And I'd also like to mention that this webinar is actually being recorded, and we will definitely share the recording link after the webinar. So to get back to today's business, we all know that immunization plays a very critical role in achieving the sustainable development goals, particularly as they relate to the SDG number 3 on ensuring healthy lives and promoting the well-being of all people around the globe at whatever age they're at. And the World Health Organization and other partners have been advancing the universal health coverage through the immunization agenda for the decade that's going to end 2030. And of course, this global strategy is aimed at making sure that no one is left behind. And it is popularly known as the IA2030. So what has happened over the years is Bill and Melinda Gates Foundation, together with Gavi, the Vaccine Alliance, and the World Health Organization, engaged CATI Collective, a group of consultants, to develop a multi-year framework for the Immunization Agenda 2030. And they came up with a data strategic action plan, which has been focusing on the principles of a data-guided framework. So today, we are honored yet again to have Kirsten from CATI Collective, who will speak to us about the work that has been undertaken by the Data Strategy and Use Working Group. And we'll get to hear, what they've done this far, and how we can all get engaged in the implementation of this strategy through the working group. A special thanks to all of you who particularly provided feedback and influenced the overall outcome of the actionable priority items in the document. And I think some more great news is that we have another opportunity today to learn about how we can actually get involved in the working group itself in order to implement this strategy. Kirsten, like I mentioned, is not new to the BLN platform. She's been here, I think, a couple of times and shared with us the work around the AI data strategy. And for those of you who don't know her too well, she's the founder and CEO of Kati Collective. Person, it's great to have you on board once again. And we're really excited to have you on board so that you can share with us the latest development on the strategy, as well as the working group itself. So without much further ado, I will invite Christian to just introduce herself, tell us a bit more about herself, and also about the role of Kati Collective in the work that has been done around the IA2030 data strategy, as well as the working group. Christian, over to you.
Great. Thank you, Catherine. I'm happy to be here again. And we always feel like this is a really important group to be engaging with for the work. And I'll just start with where we left off last time, which was going over some of this work and actually bringing drafts of the content to this group, as well as to eScholars and the Boost network as well. And we did then end up having webinars with your members and really including that information in the final version of the content that came out, which is part of what I'll talk about today. So all this just to say is that we really are trying to create a process that involves national and subnational input and links across the many other efforts that are happening. And the focus of today is really to let you know what the ongoing working group is going to look like and how we're setting it up so that there's many opportunities for engagement for a broad network of stakeholders. And I will just note that Carolina is on the line, and she's been a part of this working group since the beginning for the past 1.5 years or so. And she is supporting this transition in the interim, working closely with us as we work to kind of get the groundwork in place to be able to transfer this work over ultimately to the WHO Secretariat. So again, I'm happy to be here. I've been working in global health for quite some time. I've done a lot of digital health work, digital health that is focused on gender. I worked in Ghana with the MOTEC project. I was the global director of MAMA and had 4 countries of implementation there. So I've really kind of tried to go back and forth between doing consulting work and actually being on the ground and implementing projects. So that's really my perspective spans really from kind of the very last mile health clinics all the way through the global infrastructure, such as what we're working with now around developing some of these frameworks for resourcing. So without talking too much more about myself, let's go ahead and move into the content of today. So if you want to, are you going to share your screen or would you like me to share mine, Catherine?
I think you can go ahead and share yours.
Okay, great. Let's get this up here. Okay. Great. So today's focus again is how to engage with the IA2030 Data Strategy and Use Working Group. Just a quick recap for those of you who haven't been on the previous calls. Really what this was a group of data for immunization experts that included folks like Carolina from the WHO, UNICEF, Gavi, Gates, CDC, Village Reach, PATH, ACASIS, CHI, and others that came together to say, okay, there's this data guided principle that's underpinning the IA 2030, but what would that actually look like if we came and as a community, a data for immunization community, and developed a set of priorities that we really focused on resourcing around and implementing over the next 10 years of the IA 2030. So that was the idea behind the IA 2030 Data Action Framework, was to have very tangible actions that could be taken at the global, national, and subnational levels. But beyond just developing the framework, we are now working on developing the process that will help keep this an engaged and living process where there's opportunity to constantly be kind of revisiting and realigning priorities across, again, global, regional, national, and subnational levels. We based it on the theory of change that really had come out of a lot of the foundational data for immunization work, looking at these actions on the far left corner and those kinds of buckets for things that were assessment and improvement planning, governance, people, tools, and evidence. And across all of those, what we did is we looked at the IA2030 strategic priority areas and the objectives associated with each of those. We asked ourselves the questions, for this strategic priority area or strategic objective to be achieved, what data would need to be in place to have high quality data that's used at the right time, at the right place, to make the right decision?
It's like the slides are not moving.
Oh, do you see the theory of change slide?
No, we're seeing the cover. We're seeing the top.
Only the cover.
Slide.
Okay, sorry, let me reshare.
Sorry about that.
Oh, that's okay.
Yep.
Are you seeing the one that says IA2030 core principles?
Yes, that's the one we're seeing right now.
Great. And then this is the one that I was just speaking to. Do you see the theory of change?
Excellent. Yes.
Okay, for set then. It must have just frozen. Thank you for letting me know. So what we did is we asked these questions across these layers, saying what would need to happen at the global level for this strategic priority area to be achieved and supported by high quality data that's used at the right time in the right place. What would need to happen at the national level and the subnational level. So we broke up into these strategic priority area groups and came up with these set of actions. And again, as we mentioned, we felt like it wasn't enough to just have the actions, but we need to have a theory of action of how would this actually be put into work. And that was having this global accountability framework, and then having partners participate in annual planning and iteration cycles. And then by doing that in an iterative way, the data systems will ultimately be transformed or strengthened and expanded in order to achieve the IA2030 goals. So I'll give you a pointer to where you can find the full document. I'm not going to get into a lot of the details of the document today. Rather, talking about this middle part around this annual planning and iteration cycle and what that's looking like and how you can engage in that to make sure that this really becomes a living, updated set of priorities that is resourced around and implemented globally. So here's a link, and just if you, for any reason, have trouble grabbing the link, it's on the Immunization Agenda 2030 website, and it's under the Resources tab, and it's called the Data Action Framework. So feel free to grab that anytime. One of the things that we did with this is we segmented the actions as transformational. Those were the top line things, and we did that at the global level that the partners felt like are the things that if invested in over the next 10 years can really make a big transformational difference in data for immunization. We also recognized and understood there's a lot of great work already happening that continues to need to be resourced and strengthened and expanded. So we have a set of activities that are called Strengthen and Expand. As we go forward, we're really thinking that probably the way that this cycle will happen is this first 3-year cycle will probably have more strengthen and expand and a little bit of transformational. As those things really get scaled up, we'll be looking at having more investment in transformational in that second set of 3 years. And by the end, we're looking that those transformational things will actually end up starting to be the strengthen and expand, and there will be likely some new transformational actions that will come on board. So again, really looking at this as a living framework. So just switching now from the actual framework to the Secretariat at the IA2030 and how this work will kind of live on and be engaged. So this is just a quick overview of what the IA2030 Secretariat structure looks like. It will be headed by a unit head at the WHO. And they basically have these consultative engagements over here with these IA2030 working groups. They have technical working groups that are by priority area or strategic priority area, and then functional working groups that are M&E and communications and advocacy and that kind of thing. This working group is a little bit different. It crosses all of those working groups. And so part of what we're trying to set up here is how to make sure that this working group is engaged with all of those others, so that this working group is both informing those strategic priority area and the M&E and communications working group, but also being informed by those groups. So you can see this group has kind of an important and cross-cutting purpose as this work moves forward. So as we've been developing the terms of reference for this group, again, we've been imagining this as having a 3-year set of priorities to really hone and focus each 3 years that would be based on the content that's in that data strategy framework. So we are now kind of in pre-year 1 or almost year 0, where we are setting the first set of 3-year priorities. And this is happening in November. I'll get to it in just a moment. And what we'll do is set the first 3-year set of priorities. And based on what those priorities are, we'll be having a core membership group and then a community of practice. And the idea is that particularly the core membership group would be people across a number of different organizations and perspectives that have skill sets that relate to the priorities that are set for that 3 years. And that membership would continue to roll based on the priorities as they shift and change every 3 years. So it really is a rolling 3-year process. So in the first year of each 3-year process, we'd be securing the membership, having resourcing of updated priorities. Gavi is very much in line with this and is looking at how do they align their data submission process to this work and to be informed by the community of practice ultimately. We'll have share and learn mini sessions so that we can have progress check and course corrections. The second year of each cycle would be continuing to resource the priorities, checking in on progress and being able to make some adjustments to priorities. And even as we've spoken with Gavi and others, having opportunities annually to be able to make adjustments, slight adjustments to work plans and funding. And then finally, in year 3, we would be doing a larger kind of share and learn meeting where the next 3-year set of priorities would be informed by what happened during the previous 3 years. So that's kind of the rolling cycle. And again, we're at kind of year 0 of this right now and setting the first 3-year set of priorities. This is just a quick visual of showing you, we tried to line this process up with the Gavi submission process. As Carolina knows, WHO and UNICEF are doing their submission right now. The current working group had an opportunity to just review that submission and map it against the transformational priorities, just to have a discussion about where are there some gaps and where might those gaps be filled by, for example, extended partners and others. So we're beginning to start to have that process be a little bit different than it's been seen in the past. But the idea here, as you see these yellow dotted lines, is that there's an opportunity each year to kind of come back, check in, and realign. And even though the Gavi funding is a 4-year grant period, there are opportunities to kind of readjust and realign annually. So we're just continuing now to secure the Secretariat structure. I'll get in just a moment to how you can be involved in that. And then as we get that first 3-year set of priorities, we'll have near, mid, and long-term targets for those. And then really looking at how we can socialize this into the planning cycles of not only the global partners, but for countries as well. And then the idea is that at the end of December, early January, this all kind of gets handed over to WHO to really take and own and manage over time. So the ways in which you can be involved there's a few right now. So one is in order to inform our first 3-year set of priorities, we really want to base it on what's working and learning from what's happening in the field. And Amelia, this actually reminds me of your work that you're doing And I think it could be interesting to take, and we certainly did take a look at that discovery work as we were mapping out the priorities, but it would be interesting to look at some of the latest iterations of that and see how it relates and how it can help inform. But we want to kind of know what's been happening, what needs to be strengthened and expanded, what are some of the transformational things that you think need to happen. So we have this very simple survey on SurveyMonkey that we invite you to fill out that basically is just pointing us to who we need to contact to get information on things that should be considered as inputs to the next 3-year priorities. So that's one way you can engage. The other way is that we are currently collecting contact information for anybody that is interested in being involved in the community of practice or interested in being considered for core membership as we form this first set of membership. And the core membership will be formed after we have our November meetings, and we'll go through that process by the end of the year. So if you see here, Brooke is my colleague. She's on holiday this week, so couldn't be here, but email Brooke and just let her know if you'd like to be on our list to be sent information for the community of practice or core membership. And again, we're looking from people from across perspectives, across different levels, and would love to have your name in our database so that we can make sure that we're communicating with you. And then the final way is to join the priority setting meetings. Now, unfortunately, these are a set of 4 meetings that we are doing in a virtual format, given the moment that we're in right now. We have 90-minute segments. There are 4 meetings, November 2nd, 4th, 8th, and 10th, from 3:30 to 5 p.m. Geneva. I know that's a little bit late for some of you. And we need people to be able to attend all set of 4, because one meeting will build on the next meeting, will build on the next meeting. So if you're available and think that you can carve out the time to attend those 4 meetings, we'd love to hear from you. And would love to have your engagement and involvement. Again, we'll be kind of agreeing on the final 3 set of priorities, or the set of 3-year priorities. And then we'll also be looking at how do we do this work differently? How do we approach it differently? What would that look like? And what do we need to build into our processes moving forward to make sure that as we're looking at these actions, we're not just kind of measuring and looking at the actions, but really looking at the change management around these and looking at how these actions can be implemented in a way that is more inclusive and aligned and transparent and resourced. So that was a lot of information. I will stop there, and I am happy to answer any questions that you have.
Thank you very much, Kristen. That's really interesting and very exciting. I like the part about the, how you spoke about the different ways in which, the audience could get involved through the SurveyMonkey. Then you spoke about, as pointers to, communities of practice membership and the core membership, across the different perspectives, as well as joining those 4 meetings, or is it workshops that will be held shortly. So we're opening it to the floor for any questions. Do we have any questions? You're free to lift up your hand and mute your mic and ask the question that you might have, or for those of you who had read, I haven't seen any questions or in the chat box yet. But we can pick those up if you've got them in the chat box. Any questions for now? Any questions for Kristen?
Also, I would invite Carolina, if you've got anything you want to add or anything you want to make extra points about, feel free.
Excellent, excellent. Carolina, did you want to add anything to what Kristen said?
I mean, she was so clear. I just want to welcome the people who have joined us. Happy to see some familiar names, like Palemfo is here.
Oh,
people who are really working closely with the country. So I would really encourage you to join this work, because it's kind of what we are tired of, is to see things coming from Geneva, New York, whatever, trying to get to the country. I think the pandemic has helped us democratize knowledge and democratize, because we have more access to being together in the same meetings and discuss.
Mhm.
So please help us make things more useful for you who are closer to countries and to the local level. So thank you.
Thank you so much for those encouraging words, Caroline, and you're right. I think that has been a source of concern globally, where we're trying to make sure that the various countries out there become, more involved in whatever products or global goods that are being produced out there. Do we have any questions? You can lift your hand. Anyways, as we're waiting for questions, I have one question. I just wanted to be clear about this. So we're talking about this working group, and I think you ably put it that there'll be like, it will be operating in the next, in 3 years, like for a period of 3 years. So does this 3 years start now in 2021, or are we talking about beginning 2022?
So the 3 years will start 2022. This is kind of a bridge year, if you will.
Okay. Oh, excellent. Excellent. And
so it'll be 22, 23, 24 is the first 3 year, 25, 26, 27, and then 28.
29, 30.
So it's technically 9 years because there's been a year of planning.
Wow. That's very interesting. Any questions from the audience?
And Catherine, I'm not sure if you sent it out, but feel free to send my the PowerPoint deck out.
Yes, I will, definitely.
And then people can feel free to forward it to your colleagues. And again, just take note of the dates that we need to hear from you by. These meetings, again, are early November, and so we really need to hear as soon as possible on the projects we should be looking at as inputs, but then also by mid-October, if you're interested in joining the meetings. We just really need to know who's joining and how many and whether we need translation, and it will definitely affect the way that we facilitate the meeting depending on how many people are new and all of those things. So we need to know ahead of time.
Excellent. And I think you raised a very good point there. I think this meeting that we're having today, this webinar that we're having today, was actually focusing on the Bid Learning Network community, so to speak. And I think one of the challenges that we normally face, because this is composed of different countries from the sub-Saharan Africa who are Francophone, they're Lusophone, and they're Anglophone. And you spoke about the translation support in the forthcoming meetings. But if they were to join the working group, is there a provision for you to have that mix of people? How do you intend to address that issue? Because I think it's been one of our challenges.
It's a great question, and we'll do our best to try to have it be part of the priority setting meeting. But absolutely, I think as we finalize the TRRs and the way that these groups will work, that we absolutely have to make sure that it's multilingual, accessible. So I've got that noted, and that's part of what we'll be kind of working on.
Great. I think that would be very good. Because I think that's one of the challenges we've had as a continent, and to bring all these people together. And there's a wealth of expertise and knowledge. Yeah. So I think it's a good, mix of people to tap into. Yeah. Any questions from the audience? I have a whole lot of questions, but let me give an opportunity to other people. Are there any questions from the audience? Palemfo, any questions? Marie, any questions? I've seen Claudia there. Bertha, do you have any questions?
Hello, this is Bertha.
Hi, Bertha.
Thank you. Hi. Thank you so much for the wonderful presentation. I would want to know the fact that you have this agenda of this framework, which I've tried to go through. It's a rich one, and it is basically tackling a lot of things, right from national, global, subnational, which is a very wonderful thing. I would want to know the fact that implementing such a thing would require you to initiate it, engage stakeholder, capacity building, goals, monitor, and what could be the key indicators that you're going to use to measure the progress of how well you have performed in these like three-year time span you have put in place? Thank you so much.
That's a great question, Bertha, and that is part of what we are working on between now and the end of the year. So as soon as these 3-year priorities are set in early November, then the next step will be to determine what kind of SMART goals we can attach to those. But as I was having a call yesterday with the interim lead, Hope Johnson from Gavi, we were talking a lot about the need for us to have kind of process indicators, because part of what we're trying to do here is really change the process and approach and have a process that allows for iterating and adjusting. And so we're trying to think through how we can actually measure that we've been successful in having a different kind of process for this, if that makes sense. But that is very much on our radar for doing that. I also just want to note the comment in the chat around the NIS and the FPP for Gavi. And again, I think Gavi's been very involved in this and is working to align their processes to this. And the idea would be, you know, as countries, the more that they can align their data priorities and asks to what's in this framework, you know, the idea is that that would help with moving towards the resourcing piece, because all of this is intended to be aligned. Sorry, Carolina, did you have a comment?
Yes, thank you. I wanted to make the comment that to Bertha, because that's a really great question, because we want to make sure that this group, it's not only Gavi focus, right? It's the immunization agenda 2030 for the entire world as well. And countries are at different in different places in how they are using their data, what their needs are, where they need to put more focus on using that data, for example. So we also probably will have to bring together some other initiatives. For example, there is already indicators that look at, I work on surveys, but also how surveys are taking into account, for example, in planning for campaigns. So whether that source of information was even considered or mentioned in some of the planning. So there are things already happening that we already need to take a stock and understand, so we don't duplicate and really take advantage of what's happening and what it's being monitored already, to not overload and create new processes. So I fully agree that we'll have to be creative, because we need to measure progress, like, are we doing better? But in a diverse world, it's probably not a one size fits all for this. And we welcome you to the group, so you could probably, you know, everybody can help us define some of these things. Thank you.
Amazing. I think that is, you know, very, very well said. I think we need to do things a bit differently and think outside the box. And I can see a lot of, you know, great ideas coming from there. So just a quick one. And, you know, as you were talking about that, I was thinking about the membership to the core, is it the core membership group and the communities of practice? So are these just limited to, for instance, because I think you've been talking about aligning ourselves or our programs to what Gavi is doing and everything. Are we allowed to, for instance, to make suggestions for like the private sector to come in to be part of the members? Are you looking at that as well? Or are you just looking at the public sector?
We're looking at both. So
okay.
I'm sorry, I don't have my slide with me right now that has the list of organizations for the core membership group. The idea is that it would line up with those that are on, hold on, let me show you the structure here. Those that are involved in this partnership council under leadership here. So we would have members that are part of the same organizations that are on the partnership council, plus a little bit more expanded in the core membership group. And that also includes having some sort of somebody from the private, a relevant private sector. And then the community of practice is meant to be a very broad, inclusive group where people can kind of self-select and come in and out of that group. So definitely we want to have a broader set of inputs. And the idea is that the core membership group would be tapping into the community of practice for inputs and thought partnership and direction and guidance, but that the core membership ultimately is the one who would be kind of making the decisions with the input of the community of practice.
Excellent. This is amazing. We're certainly not leaving anyone behind.
We're trying not to. But your point is well taken that we do, in fact, leave people behind if we can't have translation.
Yeah. Excellent.
I also just wanted to call attention to Amelia's note and the amazing work. That Vaccine Data Insights is really an incredible body of work that I know Amelia has been working on. You might want to, do you want to talk about it for a couple minutes, Amelia? But I think it's an incredible resource and one that definitely will continue to be an input to this process.
Sure. Thanks so much, Kirsten. I think I just wanted to call out because I think, as you're raising a really important point around making sure that you're including, not only country level voices in setting strategies, but also making sure that you're not just looking at national level within those countries. So I think that's something that really stands out about this research work we've done in collaboration with JSI, is we've gone to 3 countries, Kenya, DRC, and Mozambique, and really have talked to stakeholders in every level of the system, from community all the way through facility, subnational, and national, and taken the time to kind of have one-on-one conversations with them to understand from their point of view, what are the challenges with using data and kind of what are the biggest pain points for them, and have been involved in kind of a broader co-creation process now to try to understand what are the priorities and kind of identify the opportunities for moving forward and solving some of these challenges. So I encourage you to check out that work. We still are kind of due for a final report in the next month, but feel free to reach out if you'd like to get any more information. We're always kind of eager to share all of our insights. And thanks, Kirsten, for giving a platform to talk about this as well.
Tell you what, I think we could even have an entire webinar on that next time. I think that would be very, it sounds very interesting. It sounds very, very interesting. Carolina, did you want to say something? I can see your hand is up. Or was it the hand from before?
Old hand, old hand.
Amelia, I just want to say too, obviously we'll reference the Vaccine Data Insights website, but if there's anything, even if it's not final yet, that you want us to refer to as we're putting inputs into the priority setting meeting, feel free to just send me a draft and just let me know that it's a draft, but it might be useful for us to have whatever kind of your most up-to-date stuff is.
Sure thing. There are resources on the website that are relatively up to date. I would especially recommend the cross-country root cause analysis document, but I will make sure we keep you posted as soon as we have additional stuff. So where we're at right now is we've done co-creation workshops in the 3 countries with stakeholders to identify the opportunities. So we have kind of lists of opportunities from the 3 countries, and now we're combining that into the cross-country opportunities, which will be that final report. But beyond that, everything else is up to date on the website.
Okay, cool. Thank you.
Okay, so we've got about, I think, about 15 more minutes to go. Are there any other questions? Please feel free. Are there any other questions that you might want clarification on? Before Kirsten leaves.
Claudia, I see you have a hand up.
Claudia, yes?
Well, no, just I think everything that my questions were also mentioned. I think it's a really good strategy, going to some national level. So I like that, and I always link that to GIS, kind of potentials that they have, the geographic information systems for analysis, which is a big topic that I don't see it as use in other countries, and to be able to analyze spatial do spatial analysis with different type of determinants, no, health and other things. So I think it's a good potential for it, and thank you. And nice to see you, Carolina.
Great.
You too.
This is really, really great. I mean, I'm so excited about this, and especially, the part about being able to help with the setting up, the setting of data priorities for the next 3 years. I think that's a very important exercise. And I hope, Christian and the team, you'll be pleased to have like more members coming in from the BLN to assist with this.
Yep, we'll look forward to engagement from your membership.
That would be great. So we will, as a learning network, just try to just make sure that the membership is involved in this. Like I had mentioned earlier before we set up the webinar, saying that, like right now, I think the countries are so busy with the COVID-19 response, the vaccinations going on, but I think this is an equally important exercise. So we shall impress upon them to make sure that they participate. I can see a hand from Masaina. Masaina, please, you can go ahead.
Hi, Kathy, and hi, team. Sorry, I dropped off a bit. I had internet challenges. I'm back now. I heard part of it, and it sounds to be something very exciting. Are you going to share the presentation? Thanks.
Yes, Kathy, if you want to send that out, feel free to send it to whoever, if your whole membership, if you'd like, but. Are you still there, Catherine?
Oh, sorry, I was talking to myself. Sorry.
Okay.
That happens ever so often. Yeah, so as I was saying, that, just in case we don't have any more questions, so I would like to thank Kirsten for taking time to share this important document, as well as plans on the data strategy and use working group, and how we can all get involved. Like everybody has mentioned, I think everybody was just, it was all skewed towards, how they're excited about it, and that it's a very good initiative. And I'm sure most of the people on this call are, would like to take part in one way or the other. And of course, as a learning network, we're committing to ensuring that our membership do take part in the working group in whichever way, and also share their views through the survey. We'll make sure we, share this on your behalf, and make sure that you get the information in by the 15th of October. And I will also share the emails and let them know that they could, share the information that you want. For them to express their interest in the communities of practice, and also the core membership, and also give pointers to those who might be interested. And of course, I think to make sure that they take part in the setting up, the setting of the data priorities. And I think one thing that I took out of that one particularly is how these people need to be committed to ensuring that they attend all 4 meetings that you've set up between the 2nd and the 10th of November, because they'll be building up on one another. So it's important that they're there. And I would like to believe, Christian, that this also relates to perhaps that we're not looking at individuals. For instance, if Masaina and myself, because we both work for PATH, are able to attend like 1 or 2 meetings, but are passing over the information to the other, is that allowed? I mean, would that be allowed? We're 2 people from the same organization, and if I attend like on the 2nd and on the 4th, is it possible for my colleague to take part on the 8th and on the 10th, as long as I pass on the information? Is that allowed?
As long as you pass on the information and then also let us know that that's what you're doing, so that we understand that that's how the participation will happen. So that's fine.
Okay. Yeah, because I think that would be good, because I think it would be unfortunate that, for instance, I commit to attend all 4 and then I suddenly don't pitch up. I think it would be good to bring in a proxy and ensure that there's that continuity. Okay, so thank you so much, everyone. Any last words? Any last words from Kirsten before I move on to Carolina?
Thank you. I always appreciate having the platform to talk with your members.
Thank you so much. Carolina, did you also want to say something before we wind up?
No, yes, thank you. And I hope you're all in the different emailing lists. And if not, maybe we can connect, because we do some informal sharing of data, for example, if you're interested. And then we also have a data for immunization little e-newsletter that started as something internal WHO, but now we had really tried to make it a little more broad. So if you're not in that list, just send me a message, maybe contact the BID initiative, and then we'll include you. Thank you.
Thank you so much. So maybe what I could also do to help with that is, as I send out the slides and everything, the recording and everything, maybe I could include your email and just mention that.
If you can include VP data, I will write it in the chat, because
excellent.
And you just can say subscribe me to data related things.
Excellent. We'll do just that. We'll do just that. Otherwise, thank you very much, everyone, for joining this webinar. It was very, very exciting and very interesting. You know, slightly different from what we've been working on in the last few months. We've been doing, it's been all COVID-19, but it has been so refreshing to talk about something else. And it's very, very exciting. And we will definitely share the recording. We will share the slides and any other information. And I'd like also to believe that Kirsten, you're available to take in any, to answer any queries that might be channeled through the BID Learning Network on the same.
Always.
Excellent. Yeah, so we will share your email address and of course what we agreed upon on the VP on the data to Carolina. So everybody, thank you so much. Wishing you a pleasant day. In fact, for those ones who are reaching us from anywhere other than Africa, wishing you a pleasant, is it afternoon? For others, it's probably morning or evening. Until next time, bye-bye. Thank you so much.
Bye.
Bye.
Bye, thank you.
Bye-bye.